Hi everyone, I'm Dr. Juanita Don Bashu, and it is great to be here today. Over the next 10 minutes, I will be discussing my team's CHR-funded project on mapping brain health and dementia research across Canada, identifying critical gaps and opportunity for collaborative action. So why does this research matter? With over 480,000 Canadians having a dementia diagnosis and an estimated 1 million people to be having dementia by 2030, we need coordinated action to strengthen our research efforts. Now, by identifying where gaps exist and where collaboration can be strengthened, this project sheds light on opportunities to advance brain health and dementia research in Canada. Now, our research had two interconnected objectives. First, we mapped out what research is happening across Canada, and second, we worked to identify where the gaps and opportunities exist for future efforts to find where they could have the greatest impact. To achieve our research objectives, we used a comprehensive four-step approach combining multiple research methods. We started with an environmental scan to map existing university research centers related to brain health and dementia. We conducted a scoping review protocol. We developed a rigorous scoping review of 275 Canadian studies on brain health and dementia. And then lastly, we gathered insight from 3 focus groups with a total of 20 members of the Dementia Research and Innovation Funders Alliance. Now, our environmental scan revealed 95 university research centers across Canada working on brain health and dementia research. As you can see, there's a clear concentration in the province of Ontario with 37 centers, followed by Quebec with 26, British Columbia with 12, and Alberta with 7 centers, while the other provinces showed more limited engagement. Now, what's particularly interesting is that many centers are addressing similar research topics, which presents a tremendous opportunity to connect and align these efforts and build stronger collaborations and capacity across the country. We use thematic analysis to analyze the findings from our scoping review and focus groups. Then we use the National Dementia Strategy of Canada's 3 theme areas to help us organize our findings. For example, in the area of dementia prevention, we found that there's a critical need for accessible research to support education and uptake of strategies of modifiable risk factors, along with a gap in implementing and evaluating large-scale longitudinal prevention programs to support brain health. For advancing therapies, we identified a crucial need to refine biomarker use and treatment options to provide actionable information, addressing the current gap in achieving long-term disease modification and incorporating patient and practitioner perspectives. Now, regarding quality of life, we found a significant gap related to understanding the diverse needs of people living with dementia, particularly among equity-denied groups, such as immigrants, refugees, people living with young onset dementia, as well as other groups, including those people living in rural populations. Now, our research revealed the continued underrepresentation of diverse populations in brain health and dementia research. Here we've provided a list to provide some insight from our findings of the missing groups and voices that are not often heard in brain health and dementia research. So this brings us to what we identified as the most critical challenge facing brain health and dementia research in Canada today: the implementation gap. While we have extensive research on brain health and dementia conducted across Canada, there is a substantial disconnect when it comes to translating this research knowledge into actual policy and practice, especially at the population level. Now, without coordinated efforts and strategic knowledge mobilization, even our best research will have limited impact on the lives of people living with dementia and their families. One of our focus group members shared, "I think one of the challenges is the implementation science. We're a country of pilot projects. Now, Braun and Clark's thematic analysis framework was used to analyze our data from the scoping review of reviews and also our focus groups. This picture here, this image, documents the process that we use to group our codes into the overarching themes that formed our study recommendations. Now our research revealed 4 critical recommendations for dementia and brain health research in Canada. First, we must bridge knowledge to action. Despite extensive research, an implementation gap exists. So we need to translate findings into policy, community, and individual practices to ensure a real-world impact at the population level. Second, we found that it is imperative to strengthen diversity and equity in our research populations. For example, our findings showed severe underrepresentation of certain population groups in the research, which makes us understand that inclusive research that involves and includes partnerships with equity-denied groups using community outreach is really essential for equitable care. Third, we found that research and innovation needs to move from silos to synergy. So moving from silos to synergistic partnerships between research and technological innovation is crucial to fostering ingenuity and maximizing collective impact that will really accelerate brain health and dementia research in our country. And lastly, we found that it is so important to prioritize the voices of lived experience of people living with dementia and care partners. Now, this really means centering the needs of people living with dementia in all research priorities. Their unique insights are absolutely invaluable for shaping research questions and outcomes that truly matter and will have impact at the population level. Now, based on our research findings, these 8 priorities highlight actionable areas for addressing the pressing needs to improve dementia and brain health in Canada. First, brain health promotion. That was identified numerous times. So we need to promote brain health promotion education and research across the lifespan. We can't just stop at one age group. It needs to start early on. Second, living well was often identified, where there's a focus to optimize the quality of life from the perspectives of people living with dementia themselves. Third, there's a need to really improve and enhance and strengthen diversity and equity in research. It's just so crucial to elevate research participation of diverse people living with dementia, especially among equity-denied groups. And fourth, there is such a need for multi-stakeholder collaboration. We must collaborate with diverse stakeholders, including the technological and technology sector, to bolster innovation, data sharing, and capacity building at both the national and international levels. Fifth, there's a huge need for implementation science. So this really involves bridging knowledge to action and mobilization at the policy, community, and individual levels so we can ensure that there is an impact at the population level. And 6, care partner support is just so critical. We need to improve care partner supports and really ensure that there's adequate respite care available. 7th, end of life planning. So this priority is really all about advancing care planning and providing compassionate support during the end of life stages and making sure that we have supports in place. And finally, community care. We need to prioritize community care models to enhance dementia care and contribute to health system transformation. We hear so much about dementia inclusive communities and care happening at the community level, but we need to ensure that those models of community care are in place. Now, we believe, based on our research, that the most pressing barrier to impact remains the critical knowledge to action and implementation gap. So in order to move forward, we believe that it is so necessary to prioritize implementation, foster collaboration between research and technological innovation, and really work to amplify diverse voices of lived experience. And through these actions, we feel that Canada can advance brain health and dementia research. Now, this research wouldn't have been possible without our incredible partners, funders, and collaborators. I want to especially thank the Dementia Research and Innovation Funders Alliance and the CIHR Institute on Aging for their support. Our research partners with lived experience deserve special thanks, Jim Mann and Myrna Norman, for their invaluable insights, and our dedicated student trainees and our full research team who made this comprehensive study truly possible. Thank you for your attention and engagement today. I'm so excited to continue having these important conversations about how do we best advance brain health and dementia research in Canada. Please feel free to reach out to me at jbashu@tru.ca if you'd like to connect with me or you have any questions about this project. We do have a report coming out that will include comprehensive details about all of the different studies we conducted. Thank you.